Okay, great. Welcome, everyone. Welcome to today's talk from the Practical Knowledge Translation Group. Talk today is titled Truth Telling Through Patient Journey Mapping, Looking Back to Improve the Path Forward for Indigenous Patients. So we're honored to welcome Sherry today, but before I give a more formal introduction, I did want to just go over a few things. First, I wanted to acknowledge that we're physically gathered today on the unceded and ancestral territory of the Squamish, Musqueam, and Tsleil-Waututh people. I know we have quite a few people joining online as well. So if anyone is joining from a different location, please feel free to share that in the chat. And I also want to go over just a few housekeeping issues. Today's session is being recorded. So for anyone online, please make sure you stay muted during the presentation, as well as feel free to turn off your camera if that makes you feel more comfortable. You're going to be able to find this and other recordings from our Practical Knowledge Translation talks at the website that's listed on the screen right now. So it's Providence Healthcare Practical Knowledge Translation. And then we also will be using Mentimeter to gather questions for the Q&A period, as well as get some feedback on today's session. So if everyone could get that ready on their phone, because if questions come up, you can submit them at any time. It's mentimeter.com. So that's mentimeter.com. And there is a code. Oh, it's just menti.com? Oh, okay, sorry. Just menti.com. And the code is 49682403. So it's on your screen right now. I'll read it out loud one more time. The code is 49682403. So please have that ready on your phone because it will be used for the Q&A period as well as to get some feedback at the end to see what kind of talks we can do in the future. So without further ado, I would love to introduce Sherry here. Sherry is Métis and was raised in the Region 1, the Lac-La-Biche region in northern Alberta, and Treaty 8 territory. Sherry's the Director of Indigenous Relations and Community Engagement at St. Paul's, Providence Healthcare. Prior to coming to Vancouver, Sherry spent 6 years with Covenant Health Canada as the Manager of Learning and Development and has worked many years in organizational development and change management. Throughout Sherry's career, she has specialized in training, relationship building, coaching, and leadership development. Her focus is to improve Indigenous cultural safety and to amplify Indigenous perspectives to improve health outcomes for people who are First Nation, Métis, and Inuit. Sherry holds an executive MBA from Royal Roads University and a Bachelor's of Education from University of Alberta. And I know I'm very happy to welcome Sherry today. I've had a sneak peek at some of this great work, and so I hope you all really enjoyed the talk today. Okay, welcome, Sherry. Thank you.
Hi, everyone. Thank you for being here with me today and being interested in this information. Again, as Emily just stated, my name is Sherry Hunseth. I have been on this territory now for almost 2 years. What I will note with this is all of this work has taken a ton of relationship building, and it's so important to honor the folks that were willing to share their experiences with us. This is what this presentation is about. How can we actually take the information that they were so generous to provide us with and make a real difference with it? So. I will also apologize for both Neil and Lindsay, who were going to be here. Lindsay's had a bit of a scheduling conflict, and Neil had a family emergency come up. So it will just be me today. So I apologize in advance to all of you, but it's good. Today, we're going to be talking about a few different things. We're going to talk about recurring instances that are actually happening in healthcare environments, really truly about both discrimination and racism that's experienced by Indigenous people every day within the health system. We're going to talk a lot about cultural services and insights. What you're going to see throughout this presentation is recommendations that have actually come from the folks that we actually did the patient journey mapping with. We didn't create these recommendations, they created them. And I think it's really important to honor that as well. We're really going to take a look at priorities for change that were experienced and are a priority to change around their experiences. And I'd really like you to think on your own cultural safety journey. I have a number of recommendations throughout this presentation. What can you take back to your areas to actually truly make a difference for these patients that are coming in? So first things first, and I know a lot of you know what patient journey mapping is. What I've seen in context though is a few different ways that it's done. Traditionally, patient journey mapping is done by healthcare professionals, mapping out journeys that they see patients go through. The patient journey mapping that we did here, and the information that you're going to see here was actually done with myself, another facilitator, an Indigenous patient and or participant, and somebody who's actually mapping out the journey. This is direct from patients. They shared their stories. We mapped those journeys out. We did end up working with 21 different patients for this report that's come out. In total now, we've worked with 44 different patients who've been willing and wanting to share their experiences to ensure services are improved. So it really is, it's a culturally safe method. We were really careful when we were doing this to ensure that each of the patients felt comfortable where we were doing it, what we were asking about, and who was with them. So they had the opportunity to bring an elder, they had the opportunity to have ceremony if they wanted to do a smudge beforehand or whatever ceremony they preferred. They were also able to bring in a caregiver and or a liaison to support them. Most didn't want any of that. We also, for the actual facility, we did most of them in the All Nation Sacred Space. Many actually wanted to do them in their own nation though. So Squamish Nation actually opened up their facility for us to actually do a lot of work out there as well. So that's the information you'll see here. It really has been about building a relationship, rebuilding a relationship. I think most of you have heard about Indian hospitals. And the experiments and the different treatment that was done there, the denial of services in other hospitals. There's been a real lack of trust that has been formed over the last few hundred years. So this is really about the start of rebuilding these relationships to ensure people are feeling safe. It's really making sure that patients actually have a say in what's going on as well, and making sure that this is their point of view and it's honoring them. We've also now gone forward, and we will be doing this on a regular basis so that the data can actually inform and improve, right? So we're actually taking this information, coming up with the guidance. It's guiding not only the work that we do, but the work that everybody does around us as well. So why are we doing this? And I've kind of alluded to that a bit in my introduction there. Really, this is about representing the current realities of the patient experience and how they interact with the healthcare system. We're really trying to build on strengths. Not every experience was bad. There are quite a few patients that actually shared some good experiences that happened, but there are some quite horrific experiences that happened as well. What I will note at this stage is if you are Indigenous, please, if at any point in time you feel the need to speak with somebody or reach out to someone about it, please do. Again, there are some horrific stories that have come out of the information that has been collected here. Collecting and using the journey data is really important for continuous improvement. What I'll let you know about the data here again too, all of the data is checked and rechecked with the patients that shared the information. So we send not only the transcripts of the notes that they've provided, but we also send the map to ensure, is there anything you'd prefer we took out? Is there anything that you think we need to add in so that they can continue to do that? They also own this information. We don't own it. So as we're using it, we ask permission for how we're utilizing it and let them know what we're thinking of for the usage as well. So they're helping us to measure progress here at Providence Healthcare. For those who aren't here, we have an IRAP. It's called the Indigenous Wellness and Reconciliation Action Plan. This was formed in context with a number of different reports that have come out here in BC. The most important being the In Plain Sight report, taking the recommendations that were there and ensuring we have achievable things that we can do to improve services for Indigenous peoples at Providence Healthcare sites. It allows us to see, are we actually making the mark on this? Is there more work that needs to be done in those areas? We also know where we need to go. So there are a number of things that we're doing over the next couple of years with that IRAP strategy, but what areas are really important for us to prioritize as we're moving forward from the feedback that we're receiving here? And really taking recommendations that have come directly from the people who are impacted by them and being able to implement them are so important as well. We often hear from patients, we give feedback and things are done to us instead of actually with us. So this is an opportunity to do it with. So again, this report that I'm speaking about today represents 2 rounds of patient journey mapping that were done. 21 different patients from November 2021 and March 2022 that we worked with. The team facilitated the process. Myself, the manager of Indigenous Wellness and Reconciliation, as well as the digital mapper, and really truly made it a safe environment for those folks who were actually taking part in it. Talk about selection. Initially, when we started this, we worked with the Indigenous Wellness liaisons so that we could find patients that would be willing to participate, wanted to be a part of improving services. We also worked with a number of physicians who wanted to hear more for their areas about what was going on with the patients that they had actually seen some pretty horrific treatment with as well. And they wanted to hear that feedback. So we had a number of physicians actually volunteer names too. And then it's kind of turned into a bit of a snowball. As people are actually hearing about what's happening with the patient journey mapping, we've had more and more Indigenous patients and participants wanting to volunteer to provide feedback because they know it's actually making a difference with services that are being provided. This project was actually, as we were asking questions, came out with really truly want it to be driven by the patient. I don't want to direct the conversations that are happening. It's not about what I want to hear, it's about what they want to share. So very open-ended questions. And the number one question that is asked is, what was your experience like at St. Paul's Hospital or at a Providence healthcare facility? And the patients drove the information and the way the sessions go from there. Every session ran anywhere from 1 hour to 2 hours long. I think one actually went for about 3 hours, but she had a lot that she needed to share. And we honor that time for them as well. And there's been a very thorough analysis of the transcripts. We've come up with a number of key themes, and I'll share those as we're going to. So as I said, this number has gone up. We've now worked with 44 Indigenous patients, and the care has been over the last 24 months. That's the one requirement that we have, is that they've been a patient here within that last 24-month time period. You can see the demographics. We worked with a number of males, females, representation from LGBTQIA2S+. Ages ranged between the early 30s and the late 60s. And then you can see the places of residence as well. We did have one from a rural community. She spoke very much about what her travel journey was like as well, coming to the facility. And we have received feedback for areas throughout. There was almost no area that wasn't touched in the information that they provided us with. So the key themes that have come out on this, and I'll share each one of these with you. Really, first and foremost is the patient experience, about cultural safety. How safe are they feeling? What's making them feel safe and what isn't? Talking about racism, discrimination, quality of care. The second area that we're going to look at is the transitions and stages of care. We found a lot of information in travel to and from the hospital, whether they be in Vancouver or outside of. We also found a lot of information about the caring environments that people were actually in. We heard a ton about that. And coordination of care, what that actually looked like. So transitions, day shift into night, what did that look like for patients as well? Indigenous cultural services, you will hear, and what I'll state here is the Indigenous wellness liaisons were mentioned by every single patient that we worked with. We also heard a lot about elders, cultural services that people would like to see, and then a lot about traditional medicines, food, right? Food is medicine. We also heard about the physical spaces that are available for patients to come to, sacred spaces, medicine gardens, and then processes in terms of health system transformation, really talking about self-identification and talking about the education and training that they would like to see in facilities as well. So first area we'll talk about is cultural safety. This patient I would really especially like to honor. He just passed away about 2 months ago in care. He was able to share information with us just in December of 2021. Really lovely patient to work with, had a real penchant for Harry Potter. You can see the purple sweatshirt he's wearing in the mapping there. There's a giant image of Harry Potter on his sweater. We bonded over that, which was really lovely. This gentleman stated he actually had a really good experience within St. Paul's Hospital. He was very impressed with the nursing staff, with the doctors, but he also had some areas that he felt that needed to be improved. He stated he came in for a cardiac incident, and he stated when he came in with all of the monitors going on, this wasn't a place to rest. There was a lot going on around him all over the place. He knew it was supposed to be a place of healing. There were times when he didn't feel like that because there were so many interruptions in his sleep, in the times when he actually felt that he needed to be able to sleep as well. For the most part, he felt really safe. He noted he felt really good with the Indigenous Wellness and Reconciliation team. He was really happy about that. He also noted that he would really like for people to have a deeper connection, that it was really important with care providers to actually personalize the treatment a little bit more and to learn more about culture and ceremony. He also noted in his experience, and this is what stood out for me most with this patient, it costs $0 to be kind. So with that in mind, for a few patients, and I had noted this earlier, it was overall a positive experience, right, with the care that they had received. And we have a number of examples of that. What you're going to hear me speak about in this area is 6 main pieces, really about respect, the respect that people are feeling when they come into the facility. Reciprocity, being able to have that back and forth respect, being able to hear and understand the information that's coming back. Relationality, so important as Indigenous people that we feel like we have a relationship in order to be able to trust. Safety, and that's part and parcel with it. Do you feel safe? Empowerment. This is another piece of the puzzle. And we heard over and over again that people didn't actually know what was happening to them. So how can you feel empowered in your patient journey if you don't know what's happening? Can you actually make decisions? And that leads into equity. Do you feel like an equal partner in your patient journey while things are happening? So again, in many cases, we heard mostly negative experiences here, but there were small threads of cultural safety and positives that you could see happening throughout. Many of the culturally safe experiences that they experienced were with the Indigenous wellness liaisons as well. And that's a very important thread that you'll see woven throughout this too. This patient was a 35-year-old female, identified as being from an Indigenous nation here in BC. This woman had her baby here and she had it during COVID, so felt quite lonely. Typically for most Indigenous nations, birth is about family and having family come to visit and having family supports. This, her occurrence within the hospital happened right in the throes of when COVID was most serious. And so none of her family was able to come and visit. She felt very lonely and was starting to become more and more depressed. So when she left the hospital, was kind of still feeling in that low state. What she stated was instead of being offered the postpartum and emotional support that she needed, she was sent home and reported to child services. My buzzer rang and there was a social worker and the police. I think that someone from the hospital called Vancouver Aboriginal Child and Family Services and the police because they thought I wouldn't be able to take care of the baby. She needed emotional support. She needed counseling. She needed to be able to be with her family. And instead, the authorities were called. They came to her home every day for 2 weeks. So we take a look at this: Indigenous specific racism, discriminatory treatment, poor quality, and access to care. This is an enduring reality for most Indigenous patients. It's felt. People don't feel safe coming into the facility. Many instances of stereotyping and racism have come up in these patient journey maps, being thought of as less than, less worthy of care, often being asked if they use alcohol, often asking how much alcohol they use as the first question, regardless of what they've come in for, being accused of drug-seeking behavior and being inadequate parents as well, over and over and over again. As a result of this stereotyping, many patients feel like they're being treated differently. They feel like they're being denied services or they're being made to wait longer, right? And there's a ton of fear of being stereotyped. I've heard over and over again, there are a number of Indigenous women in the downtown east side that are so hard to reach because they feel so unsafe coming into facilities, because they feel like they're going to be judged the moment they walk into the doors. Compounding oppression. This woman, Métis, she actually lives in the downtown east side. She has noted that she actually struggles with substance abuse. And she came up with a term that really has coined this compounding oppression, the 3 strikes. She felt like walking into the hospital, she already had 3 strikes against her. She was a drug user, is an ongoing drug user. She lived in the downtown east side, and she was Indigenous. And she felt that compounding oppression come directly at her with all of the services that were provided. She spent a weekend in the hospital with us, and she stated that it was the most humiliating experience she's ever had in her life. While she was here, she was actually hooked up with a catheter in order to actually urinate properly. And it started to leak. It was too full, and she buzzed to let people know. She actually sat and soiled her own bed and sat in that for 7 hours. She'd never been so humiliated, so embarrassed. She could smell it, right? How is that a place to feel like you're healing? So indigeneity combined with socioeconomic factors have really influenced their healthcare experience. Not only the experience that they're feeling, but also their own well-being, their own feeling of safety, feeling like they're being judged here. We've heard serious concerns with the security team here at the hospital. We've heard that over and over again. We've heard experiences of them just even sitting in the hospital and watching others experience racism as well. We've also seen and heard bullying and different areas of using unnecessary force and a real lack of compassion for folks. A number of priorities for change have come up due to the information that's been shared here as well. Really looking at ways to increase access to emotional, mental, and spiritual care. What is it that the patients are really looking for? And not making the assumption. There are over 200 First Nations here in BC, over 30 different languages spoken. So making the assumption that somebody likes smudging is not an assumption that should be made. Making the assumption that somebody needs drumming or, specific elder. Always ask the questions instead of making those assumptions. Prioritizing safety interventions with security has also been something that's come up over and over again as well. Auditing patient charts. An example for patient charts is we were working with a patient. It's gone through complaints as well. This gentleman came in and was just actually realigning himself with his family history. He was Cree, and he had started learning Cree songs. And in healing, oftentimes with his nation, it's really about singing those songs because it helps with your journey. It helps with you feeling the healing. And in his patient chart that was audited after the fact, somebody had written, patient was speaking in tongues, need to actually do a mental health assessment. Taking a look at that and actually understanding what was happening and asking the questions rather than making assumptions about that. Really taking a look at making sure that human resources is even collaborating with IWR. We're looking at the EDI stuff. I see somebody from the EDI team here right now, right? And making sure intersectionality is actually dealt with as well. And developing different policies. We actually now have a new team member, Director of Indigenous Cultural Safety Development, who's working very heavily on policies as well. You'll see one coming out next week. Different provider strategies. We've come up with a number of strategies with the patients. And I would ask you to take a look at these and see if there's anything that you can actually do in your areas as well. Really making sure you're connecting with an Indigenous wellness liaison where possible. Recognizing the differences in Indigenous people's communication styles, advocating for patients when you see that there are things that aren't going well, making efforts to address any concerns that patients have, providing documentations that patients need for other services as well, and explaining those services, and taking great caution when you're reporting different things, much like that woman who ended up with backfast at her door every single day for 2 weeks. Did that need to happen? Right. Patient experience, transitions and stages of care. This came up quite often in patient journeys. Number one area that we looked at was travel to and from the hospital, admissions and discharge. This patient is actually very well known in the community, really truly fighting for Indigenous rights, and really wanted to give feedback as well. What she's noted is especially seeing Indigenous peoples down in the downtown east side. They were often leaving the hospital with no supports. They had nowhere to go. They didn't have any clothing. Some of them actually left the hospital without footwear. So we're wearing those socks that are given out in the units and feeling really unsafe, not understanding what they were supposed to be doing when they were leaving discharge, right? Not having or feeling comfortable to ask any questions there as well. So there was a real challenge around accessing accommodations. A lot of these folks that are coming from the downtown east side are homeless, without home, right? So when we're actually taking a look at this, what kind of funding is available to them and setting them up for success, rather than just letting them leave the door, or allowing them to feel comfortable enough to ask those questions, because often they don't feel safe here and are trying to actually escape the hospital rather than receive the care that they need. Travel services need to also address social, medical, and cultural needs as well. Do they need access to an elder? Do they need access to spiritual supports, right? This patient came to us from, I believe, the Yukon. And when we were actually working with her, she really addressed the need for cultural education and the need for people to understand that Indigenous women are quite modest. Oftentimes, what we would hear about is patients that were Indigenous were put in rooms with a number of other Indigenous patients, whether they were male or female. While they appreciated being with other Indigenous patients, they didn't feel safe if they were in their rooms with a number of other males, if they were female. That wasn't a safe space for people to be, or with males in general, right? A lot of Indigenous women have experienced trauma and unspeakable trauma. So ensuring that they're in a space where they can actually sleep, feel safe, knowing that they're receiving care that they need, right? People need cultural education. Most Indigenous women are modest. It's important for staff to remember to be mindful of patients' dignity and privacy. During this woman's time here, she found a number of interactions very disrespectful. She felt that any time I needed to ask for anything, even small things like a snack or a blanket, I was made to feel like it was a big deal and that I shouldn't bother the nurses. In the 65 days that this woman was in care here at St. Paul's Hospital, she was only offered help to have a shower 2 times, and she was only able to wash her hair once in the 65 days that she was here. So that leads us to think about caring environments. I spoke a little bit earlier about the patient who was in her soiled bed for 7 hours. That weekend in the hospital being the most humiliating experience of her life. In many cases, we found that basic comforts and care of patients like personal hygiene, blankets, and food wasn't there. Many noted difficulties in having the confidence to ask for these basic needs. If you're in a facility and you already don't trust the people that are there, are you going to feel comfortable asking those questions? Are you going to feel like people are going to respect you asking those questions? And these are the challenges that we're dealing with right now. Many Indigenous patients, especially those using substances, really truly noted experiencing that racism, experiencing bullying, and not wanting to come into the facility. Many actually note this as a place where they see people come to die. This patient worked with us. This would have been in March of 2022. She also was in the maternity area. She comes from a First Nation in BC, and she's visited St. Paul's Hospital a number of times. She's actually had a number of really good experiences. However, on this occasion, stated, when I had my last baby, they did not bathe the baby right away, and I didn't know why at the time. It was not explained why. They said the next nurse will. Better communication would be good. I didn't know that they weren't washing my baby because it was better for the baby. I thought they just didn't want to do it. because of her lack of trust within the healthcare system. She just thought they were being prejudiced against her. So even having a simple conversation about why or why not things are happening. Communications being a really, really important factor in this. A number of patients actually reported that the patient-provider communication was either good or excellent as well, and felt really safe with numerous nurses and doctors, but would note one or two different experiences with specific nurses or doctors as being the negative pieces. Many noted the need to strengthen transparency and clarity, and really making the information complete. What is actually going on and talking people through. So many people said they were given a package of information when they left. And when I asked the question whether or not they looked at it, they were overwhelmed by that packet of information. So were you spoken with about what was in there? I don't know. I don't know what was in there, right? Many patients also noted care that overall related to the need for better coordination, meaning shift changes. The patient who was left in her own feces and urine, it was during shift change time. There was also a woman who was actually left on a commode for 4 hours. It was also during shift change time. So making sure that those conversations are actually happening so people aren't being left in these situations. Priorities for change, really working with the IWR team to create culturally safe discharge communications, working with us to have that information and those resources available. The Indigenous Wellness Reconciliation team, the Indigenous Wellness liaisons have information, have outreach providers that are actually reaching out to work with as well. So advocating within the healthcare system for resource allocation. Right now, we're trying to double the size of the Indigenous Wellness liaison team. We're just looking for the funding to be able to do that, right? Identifying strategies for better communications, reviewing practices, identifying improvements for care coordination as well. Conferencing, allowing Indigenous patients to actually understand what's happening with them, and building in more regular bathing opportunities for patients. I know for myself, I shower every single day. I feel terrible if I don't. I couldn't imagine being a patient recovering from a serious surgery and not having my hair washed for 65 days. Speaking about now, Indigenous cultural services. This patient we've spoken about a little bit. She's the patient who reported that she had that worst experience, right? Most humiliating experience in her life. She also reported that the Indigenous Wellness Liaison saved her life. She was feeling suicidal at the time and stated, "I don't know what I would have done if I hadn't run into the Indigenous Wellness Liaison that day. It means a lot. It was a big help. Spiritually, I felt lost. The Indigenous Wellness Liaisons have helped give me hope again, and I don't feel so alone." So the Indigenous Wellness Liaisons have had a very positive impact on patients. There are some things that are important to note here, though, as well. They were able to provide respectful, identity-affirming care. There are 5 liaisons right now. They are from nations across Canada, right? We go from BC all the way out to Nova Scotia with who's working for the team. And noting that there are Indigenous patients from all across Canada as well, that is an important thing to have representation for. But again, there are over 200 nations that are represented here in BC. To have those differentiations noted and respected is so important. The IWLs also act as patient advocates, and they connect with other healthcare providers, bridging and trying to ensure that those transitions in care are actually appropriately noted for, and that the patients are actually knowing what's happening and can understand what they need to do as well. Some patients actually noted that they would have benefited from longer and more frequent visits. Again, there's only a team of 5 that are working for all of the Providence healthcare facilities, and they're spread pretty thin right now. Several patients also noted that they did not know about the Indigenous services that were available to them and weren't asked if they were Indigenous when they came into the facility. What we're finding is that's been an ongoing challenge for us too. We can't connect with the patients if we don't know that they're here. Access to elders, cultural services, and traditional medicines. I felt so alone and isolated. Someone cultural could give me additional support. This was noted over and over again. And I think I stated when we were doing patient journey mapping, we always offered up support from an elder as well. Not everybody took that opportunity, but a few found it very valuable and wanted people there. Making the assumption, and this is the other dangerous thing, is making the assumption that they do want that support there. Not everybody has actually got knowledge of or feels welcomed by their own nation just because of different things that have happened. So being really careful not to pull those services in unless the patient wants those services. They've also mentioned a number of different cultural practices that they would like to see offered through SPH. Talking circles. People are very interested in having a sweat lodge, drumming. Options for birthing or naming ceremonies have come up over and over again. Different crafts to have available, Indigenous medicines. The opportunity for a medicine garden. We're taking a serious look at that right now as well. Indigenous and culturally safe food came up over and over and over again. Hospital food, we hear about it all the time, right? And so really, truly, for Indigenous peoples, food is medicine. Almost every nation aligns with that. And so making sure that cultural foods are available has come up over and over again. We're working really closely with the nutrition group on a project right now. And within that, trying to see how we can actually pull in Indigenous foods from Indigenous providers so that Indigenous peoples who are coming in can have access to food that is medicine for them. It's really important to mention too that the patients need to know that that option is available, right? And know that this is really seriously being considered and done in a good way. So priorities for change, again, working together, right? Designing better ways to build relationships, to build those trust pieces, to develop strategies for advertising. We're working right now with the emergency department on just even a poster project. There are so many posters when you walk into the emergency department that you don't even know where to look. So what does that look like? And being able to have people understand why they would want to identify as Indigenous. Food services working very much with us. I know there's somebody in here who's been able to see a presentation from me in the past as well, just talking about the different things that patients are concerned about with food services. Expanding the program and really working with the emergency department to make sure there is an awareness and availability for these services. Physical spaces and the built environment. This patient was so wonderful to work with. This patient is a woman who was in her mid-60s. She came in through cardiac and the emergency department. She also experienced services in the surgical area and the ICU. And she talked a lot about the importance around physical spaces. She was able to visit the sacred space in her time here. So that we have an all-nation sacred space here in St. Paul's Hospital. The sacred space felt like home. It was a nice feeling. The medicines, the sage, the sweetgrass, seeing the different colors. The room had a nice feeling. And when they wheeled me back to my room, I was given a red blanket. She said she felt very special and very happy. It was the first blanket she'd actually received from anyone. She was able to take that home as a good memory for her experience here at St. Paul's Hospital as well. It's really important. Culture, sacred spaces, medicine gardens. This is our land and we need to be included, right? Important for people to have a place to perform ceremony or be brought to have ceremony. I know here at St. Paul's Hospital, we can do smudging in different areas as well, if that's what people like. We've done brushing as well. We've brought in elders to perform all different types of ceremony as well. What we've noted is, I mean, St. Paul's Hospital looks like a residential school. It has been quite triggering for a lot of patients. So really noting the cold clinical environment, really important. One patient actually was receiving services in a room and she was in stirrups and she was quite mortified to look up and see a cross right in front of her while she was actually receiving these services, especially because she's experienced so much trauma from her parents being in residential school as well, right? Not feeling safe seeing this imagery there. Most of the patients mentioned that they would love to have access to the all-nation sacred space and experienced a really good feeling in there that we're able to see it. Again, very few of the patients actually know that it's there. And again, mention of the medicine garden providing benefits, right? Growing medicines, having fresh medicines there, even smelling those medicines, and knowing that they're grown by somebody Indigenous, supporting them in a good way. So opportunities for change, we're working with different facilities teams now to find options for relocating the current All Nation Sacred Space to make it more visible for patients. This is challenging, as we know. Our hospital is quite filled, quite busy, and it's hard to move things around. Our team is looking for the possibilities of setting up a medicine garden here and looking for different ways to ensure through art, through interior design, through all of the spaces for gathering that they feel safe when Indigenous patients walk into those spaces. Health system transformation, the last area I'll talk about here. This was a journey map that was actually completed with 4 individuals who wanted to do their journey map together. That was their request in order to feel safer. They're all from the downtown east side, and really important to note, stated they actually support a lot of other Indigenous peoples down in the downtown east side and said, we are the voices for those who cannot be here. Really noted a number of things about security, noted a number of things about the importance of seeing faces that you recognize. When entering the hospital, our guard is immediately up and we remember bad experiences that we have had in the past. Any person with lived experience who have lived on the street have been mistreated here. People avoid coming in because of negative treatment. People need to be treated with dignity and context. You need to make sure we are hearing from the downtown east side. It's so important. There's so much suffering. When asked, I didn't want to say I was Indigenous. So even when people are being asked if they are Indigenous here, they're not wanting to tell people. And it's because they're scared the quality of their care is going to decrease because that's what they've experienced, not just in healthcare facilities, but in society in general. So really making sure that when self-identification questions are asked, they know why. It's about being connected with Indigenous cultural services. It's about having the opportunity to work with an Indigenous wellness liaison. So making sure people are connected with those services and really being able to be comfortable. You'll note there were so many people that were saying it was crazy that somebody would ask that I was Indigenous. Why would they want to do that? What are they going to do to me? Are they just looking to, charge me more, give me less? So much fear about discrimination. Some spoke about the importance of continuing to ask though as well, right? As people are feeling more comfortable in their journey, continue to ask that question so that they can actually be connected with, or so that when they do see the Indigenous wellness liaisons there, they can actually receive those services and or feel comfortable knowing that those services can be provided to them as well. One of the other issues that we deal with in Indigenous self-identification, I'm Indigenous, I pass as white, right? People often think I'm Italian. People often think that I'm Spanish. I've gotten everything except for Indigenous. Would I like to have Indigenous cultural services when I come into the hospital for something? Absolutely, right? So not making the assumption because somebody doesn't visibly look Indigenous to you that they aren't. Staff education and training. I would like to see more doctors and nurses learning about Indigenous ways, cultural ways, traditional medicines, and demystifying ceremonies. That man singing his healing songs in Cree, it never should have been written in that chart that he was speaking in tongues. That understanding of where that's coming from is so important, right? So Indigenous patients suggested 3 major areas for education, really around trauma-informed care. So many Indigenous women, especially in the downtown east side, are experiencing such violence right now. So being really conscious of how they're being treated when they're coming into the hospital is so important. Cultural safety and anti-racism, really important for people. And harm reduction and substance use health was another area that was noted. Really wanting to make sure violence prevention was another area that came in, deepening understandings, and training on the community resources that are available to Indigenous patients, knowing, having some knowledge, right? 40% of the people that live in the downtown east side without home or with home are Indigenous. There's a huge population of Indigenous peoples here in the city that are actually attending and receiving care here. And very specific, specifically noted they wanted all staff to be taking Indigenous cultural safety training, but really specifically noted for security personnel and nurses, mostly because those are the people they would interact with the most, first upon coming into the hospital and then when receiving care in different areas. So priorities for change, really developing strategies around training, around change management, around having people understand what's going on. We take a look in the emergency department. Even the staff that works there, there's such a quick changeover all of the time, right? So ensuring that everybody's understanding what's going on, that everybody's encouraged to continue on that journey of learning, making sure those materials are available. Aligning the patient journey mapping education, we're working really closely with the findings that are happening and ensuring that's going into the Indigenous cultural safety training that's being developed now. And ensuring that relevant departments collaborate to create options, right? To learn a little bit more about what's going on in the downtown east side as well. All right, I feel like I've been talking an awful lot. And I apologize for that. For me, this is an absolute passion and we're wanting things to be done in a really good way. So if there's any questions or anything anybody would like to say, it's the opportunity now.
Thank you so much, Sherry. I just wanted, we're welcome to take questions in the room if there are any, but we'll also bring up the Menti questions because people online might be asking questions as well. But thank you so much for sharing that talk. I think the patient statements and the quotes that you pulled forward are just very impactful. And you shared some really key strategies for staff. And I think the main message I at least took away is it's really about curiosity, communication, and collaboration. And so it's good to be aware of this. So first, I guess there's one question that came up here. And maybe, oh, actually I can see them on this. Yeah. Maybe I'll let you stay in the middle though, so you're still highlighted for the answers, but any plans to train our security staff?
Yeah, that's a really great question. The security staff that works here is actually outsourced. And I believe they're taking a look at, now that contract is kind of coming due, they're taking a look at what can be done around that. And that's going to be something that's been asked to ensure is happening, is that whoever we hire, whatever that looks like, whether it becomes in-house or is still outside contracted services, is happening. So, yeah.
So I'm going to combine a few questions here. How can staff safely ask if a client is Indigenous, and how should this be documented?
Okay, that's a really great question. There is an online module that actually kind of addresses this. But along with that, understanding what the services are. So asking, do you identify as Indigenous? The reason that we're asking is there are Indigenous support services that are available. Really thinking about it that way and ensuring that it is explained there. And having a familiarity with what those services are. So if anybody wants a presentation done about what services are provided by the Indigenous Wellness Team, please reach out on that as well.
Do you have some suggestions on some cultural safety or other further education that staff can pursue?
Yeah, we have a number of resources that have been recommended. The SANYAS program is the one that's here in BC, very specific to BC as well. Please note that's not the be all end all though, and there are a number of other things that can be done too. The University of Alberta program is a little bit more across Canada for other nations as well. And they're probably the two that we're recommending the most right now. Do know that we are working with both PHSA and VCH to ensure that we're actually doing kind of Indigenous cultural safety education that's going to be consistent for everybody across the board. As we know, people work at multiple facilities, right? And so ensuring that that is done appropriately and correctly is great. Right now, Fancy Poitras, who is the Indigenous Cultural Safety and Development Director, is in the process of developing all of these educational tools that we're going to be utilizing here. She's also got a new team member that is willing to come down and work with different units as well, just to even do some hands-on training too.
And I think, so those are some great things in the works. I think also there's quite a few options on Learning Hub too. There's courses that PHC offers on trauma-informed care and other aspects as well. So taking a look at Learning Hub might be a good option.
Yeah. Absolutely.
Okay. Were any family members spoken to in this patient journey mapping?
Yes, actually, there were quite a few patients that brought in family members, and they were able to provide feedback as well while we were actually running the patient journey mapping sessions. And there were a couple of family members who had also experienced their own care who then wanted to do patient journey maps as well. So yes, absolutely. We've got a question at the back. Hi.
Hi there. Is there an opportunity to work with the volunteer resources team? I'm a volunteer in the emergency department, and so we're the first point of contact when the nurse isn't there. So we're constantly talking to patients. Some of this information would be great for our whole team to know and like to understand that we have the Indigenous wellness liaisons and the programs that the hospital offers.
Absolutely.
I'm just going to repeat the question because they might not have heard it online, but there's a representative from Volunteer Resources in the room just asking if there's any plan to partner with them because they're often a first point of contact for many patients coming in for care.
Yeah, and we would welcome that opportunity. So if possible, if you can connect with whoever is in charge of volunteer services now, and we can start making those connections happen too. Yeah, we would absolutely welcome that as a first face for people that are coming into the hospital. Yeah, thank you. And thank you for wanting to do that.
Was there a reason behind having the Indigenous Wellness Liaison visiting later during an admission to hospital? Maybe the question's not very clear, but at what stage of admission would you recommend linking?
Oh, you know what? As soon as possible, really, truly. When it comes down to it, as soon as, I mean, there's a way to input that into Cerner, or you can actually call the line as well. The sooner that we can see patients, the better, so that they know what services are available to them. And oftentimes when they're coming into the hospital, they're very fearful of being there. So to have that familiar face there with them right away, wonderful.
There are some messages of thanks, and also if the slides can be shared, this presentation is being recorded and will be posted on the Practical Knowledge Translation website that was shared at the beginning. What are some ways that technology can support Indigenous communities?
That's an interesting question. Technology is in BC, it's an interesting area of things. Again, word of mouth and relationality are such important facets to this. Right now, we're working with the brand new website. So working with Justin Karasik's team to ensure that there's Indigenous cultural safety all around the website with this. We have been setting up and working with physicians around any appointments that are being done away as well, just ensuring that acknowledgements are being made and that same respect is shown when people are actually having those away appointments. I know that a number of physicians that I've worked with here from PHC also go out to visit sites and have spoken with us about the best ways to interact with as well. So I hope that answers the question.
I guess this is kind of forward thinking as well. How are you working with the health systems redesign for the new St. Paul's?
Okay, well, that's a really great question. My job initially when I was hired on 2 years ago was to actually work with the new St. Paul's Hospital to do engagement with both the host nations, away nations, everybody who is going to be attending. So we are integrated into almost every, not into almost every, into every aspect of this project. So going forward, we're looking at not only the facility, the All Nations Sacred Space, the Medicine Garden, we're also looking at every aspect of it, from the grounds all the way into every single service people are provided with. So I hope that answers your question as well.
Has PHC considered collaborating with professional practice to use simulation style training for healthcare providers and security?
I know we would absolutely welcome that. That would be a question for Fancy, so I can get back to whoever that person is as well. Or if that person wants to reach out to me, we would love to have that opportunity to be able to do that kind of hands-on training as well. Hi, you have a question at the back here.
Yeah, I was really excited to hear that your plans to double the liaison team. I was just wondering about a timeline for that, because I know many patients request a visit and then it takes a while because the team is very, very busy.
Yes, the team is extremely busy. Thank you for asking that question. There's also challenges in hiring right now as well. So what we're finding is in every single area, as you probably know, it's been tough to find staff. We just hired another new liaison who started on January 3rd. So those postings have continued to be up as we can hire people that are appropriate and that will fit well with the team we are doing. So we're hoping like next week. How's that sound? Yeah, good.
I think I'm going to close the question and answer period here. I tried to compile some of them, but there's lots of great questions asked. So Sherry, thank you so much to you and your team for all the work you do and for sharing your knowledge. To everyone else in the room and online, I would encourage you to don't close menti.com yet. Please complete the feedback survey. We really value your input and also your ideas for future talks. If you have any ideas or if you know of anyone in the organization doing great work that you could recommend that we kind of reach out to share, that's how we come across these excellent initiatives that we really want to publicize. So again, please fill out that survey before you go. And one last time, we'll say thank you to Sherry for the excellent presentation.
Thank you for having me. Please reach out if you have any questions as well. Good. Thank you.
Thank you.